Hey guys, what's up? Alex here, and I wanted to kind of touch on physical recovery again and talk about some things that I've experienced that I really haven't seen a whole lot of mirrored videos on YouTube. Kind of add to that breadth of knowledge. So, starting with pain. I am 3 weeks post-op tomorrow, and I am still on pain pills. So that's not something I really have seen in the past. It seems like a lot of guys are off it within the first week, and I think there's a couple of reasons for that. So I actually didn't experience any surgical trauma until day 7. I was in pain and I had some mobility issues and some nausea, but I didn't feel like I was physically cut open until day 7, and then I was just hyper aware of every single stitch, every part of my body that had been exposed to the knife, and as a result of not experiencing that trauma, I think I overdid it the first week. I think there maybe psychologically the euphoria of having surgery could have pushed that trauma out a little bit. I also think I do take pain pills for my period, so I had a naturally higher opiate level in my body, so that could have been it. At a certain point, lower tabs were completely ineffective, and I had to bump up to oxycodone. But now I'm back down to lower tab, but I am on lower tab 10, and I can push it out about 7 hours, but I'm feeling it after 6. I'm feeling a lot of pain after 6 hours. So, still on pain pills, maybe for another week even. I'm not quite sure how much longer. The doc said that she's heard of nerve pain, or she's had patients who've experienced nerve pain up to 6 weeks out, where it's kind of more pronounced than maybe the standard experience, and that's been my experience actually. So my pain is very different though. My pain before was very specific and like shooting sharp pains or sensory issues, like if I just was lightly touching my skin, it felt like pins and needles. Where now I feel like I've been beaten with a baseball bat, or just pounced, and it's muscular, like it's deeper, and it's a throb, and it's the whole surface area, and really focused on like this left armpit. So the pain sensations are just different. I don't know if it's better or worse. The sharp pain was more of like it would take my breath away, like a deep inhalation, and the throbbing kind of makes me just irritable and cranky. And I have been like kind of self-medicating with sleeping a lot, but I am exhausted. I get exhausted from simple activities, whether it's like just going out for lunch. I have to take a nap after, and I'm actually kind of shocked at how exhausted I am. I went on Saturday. There was a gender conference that was really great, and it was just like 8 hours in classrooms, and the next day I slept for 20 hours, and the day after I slept for 18 hours. Like, it just took everything out of me, and I certainly wasn't expecting that. But so the pain sensations are different, and with nerve pain, something that my doctor's having me do is called biofeedback, where I'm just touching myself a lot and trying to retrain my nerves that there isn't actually pain, kind of convincing it, because the sensory outputs are just all skew-wonky. So what I do is I've been using this lotion, and actually it's a perfect lotion because it has cocoa butter and vitamin E, and it's all natural ingredients, and so I've just been like rubbing the lotion in, and not focusing on the scars, because the scars really aren't hurting me, but just like the muscle part of it, and the tissue, and just being able to get a little bit deeper and deeper every time. And it has helped quite a bit, and I think it's very much like the premise of Reiki, where you're touching with the intent of healing. And actually, like Reiki, I can feel distinct heat coming specifically from my incisions, but the heat loss is really pronounced on this left side. And the heat loss is kind of strange because I'm cold all the time, but my temperature is where it should be. It's like 98.6, but I am cold. I think part of it's the Reiki, like the pain aspect of it. And then I think a lot of it is also I don't have the insulation that my boobs gave me. And then we've had a temperature shift. So this biofeedback, a lot of guys talk about massaging their their scars, which is also part of it. But my focus has been like the skin, the nerve aspect of it. I love Reiki. I've had the privilege of knowing two really great Reiki practitioners, and a buddy of mine comes and has given me a couple of Reiki sessions post-op that have been really helpful. And also just kind of clearing the mind, because I do feel a bit of a fog. Pain pills and being in pain for a duration of time, it's certainly like intense. So biofeedback, I haven't heard a lot of people talk about that. You may notice that I'm not wearing my surgical vest. It's a balance. I have to figure out, because if I wear it too long, I'm in pain, and if I don't wear it long enough, I'm in pain. So the pain is different, though. The surgical vest really, like, pushes me in, so the scarring on the side almost feels like it's cutting into me muscularly. I don't know, it's very, like, kind of incision feeling. So if I wear, like, after I sleep for maybe 12 hours at night, I wake up, take some ibuprofen or Loratab, and then I take off my vest and I go back to bed for, I don't know, another 2 hours or so. I sleep an average of 14 hours in the evenings, like whatever my bedtime is. So yeah, the surgical vest, if I wear it too long, it does hurt. And then if I don't wear it, this whole, like, I think it's almost like a gravity pulling ache, like, because it's all on the front of my chest that it hurts. So yeah, the surgical vest has some emotional stability to it. Like I had mentioned, I feel safer in it, I feel secure in it, but I also have a very real reduction of pain when I wear it. So just kind of wanted to touch on that. I mentioned the lotion that I've been using is just a natural lotion, which I actually normally use this hemp's stuff, but there's no natural ingredients in it. Like I thought there would be, but I just like the smell of it. But yeah, so I'm not using this for my scarring or to put it on my upper body. I still use it, but just not anywhere near my chest. And then for deodorant, I'm using this like hippie crystal stick thing. It's all natural. It's pretty much just a salt stick that you put some water on and just put on like deodorant, but it's not antiperspirant or anything. So I'm just really conscious of what I'm putting on my body. I won't be doing Mederma scar strips for another week, and you can actually do them too soon. The scar has to build up. So if you do Mederma too soon, it's counterproductive and it breaks down something that hasn't been established yet. So I don't know like what the repercussions could be, but you want to wait to do Mederma until the doctor clears you for that. So there's that. And then I also wanted to talk about the sensation of the scars themselves. So I've never really had a scar like this. I've never had an operation, and I was worried because it's so hard. It feels like it's a rope like cutting into me, and the incisions, I mean the stitches are still there, so that's going to be part of it, and that's, I mean, why you're going to massage it down is because it's raised, and it's like and I have complete sensation 100%. I can feel on my nipples even, like I can feel everything. It's not pressure, it's like tactile sensory stuff. But so I'll feel like the softness of my tissue, and then the scar is just like a calcium deposit almost, like it's just hard. So that was something that I really hadn't heard people talk about, was how it feels to touch. Oh, you'll see my nipples. I have very light nipples. I've always had light nipples. I was hoping this surgery would actually make them a little bit darker with scar tissue. And you'll see this nipple. Oh, no, this one is darker than the other one. It hasn't taken as well to the skin graft. It's not that it's not black or anything. It's just, I don't know how kind of good I can. Let's see. The tissue is like it almost is like Play-Doh. Like if it gets too saturated with an ointment, it's a lot more pliable. which is strange because it's like my tissue, you know, but it like literally can like be molded almost. It's still taking, it just didn't take 100%. So the aesthetic loss will be some projection issues, which whatever, I could care less about. Overall, I'm very happy with my chest. I told my doctor if I was in pain for the rest of my life, I would be okay with that. She said she would not be okay with that. But yeah, I feel very good about it. And this is a little bit of tissue right here, but you know, I think it looks really good with my shirt on. Like, I'm kind of surprised with what a muscular little build I have. Like, obviously I have chub, and I'm not going to sit here and say I don't. But yeah, I love my chest. I love it, and it's been a great experience. But I have had some very distinct pain issues come up that I really haven't heard a lot of people speak on this late into the game. In fact, with my level of exhaustion, I don't know if I'll be going back to work on Monday. I might push it out another week, which work will be fine with, and I'll still get my full pay. It's just I won't hit my bonus, which I would feel in December, which is just a shitty time to not get your bonus. I get a monthly bonus at work, so yeah, I may not be up to an 8-hour day starting Monday. Right now I can barely do like a 3-hour event, and when I did an 8-hour day, I just slept 20 hours the following day. So I'm just really exhausted. Just everything kind of takes a lot more effort for me. But yeah, other than that, like, I am feeling really good. I just, like I said, have some pain stuff going on, and my computer's acting up, so sometimes it's working, sometimes it's not, which is just a crappy timing, because I've been watching Netflix, and I'm not really focused enough to really sit down and read like a full book, but I have been reading. And I wanted to show you guys this pretty tie I got. I went shopping with my dad for my cousin's birthday present at Nordstrom's Rack, and they have like they have like name brand stuff at really reasonable rates. So this is a Ted Baker, and Ted Baker ties are normally like $150, and I got it for like $27. I think it's a really beautiful tie, but what I really like about it is my dad and I kind of picked it out together. I paid for it, but I wanted something like a special tie for starting to saucer and having surgery and going back to work. I don't really wear sweater vests, but I'm gonna like just wear a dress shirt and a tie because it looks really good, like on my flat chest. So anyway, yeah, I just wanted to touch on some of the physical aspects of recovery again. I am kind of articulating some thoughts on emotional recovery because it is very, very different. So I hope to make another video about that, and I hope you guys are doing well. All right, lots of love. Bye.